The Kyrgyz Ministry of Health and the Rostropovich Foundation, together with the 376th Expeditionary Medical Group from the Transitcentermanas-No, wrapped up the first phase of a nationwide health initiative recently. An estimated 40 to 50% of children in Kyrgyzstan have some sort of intestinal parasite, so an effort was made to deworm every child throughout the country. And while the transit center didn't have a central role in giving the medication, they still provided some critical help.
We funded the first phase of the campaign. It covered about 3 million children and adults throughout the country. So all of the children and a portion of the adults were treated for the intestinal parasites.
With the first phase of the program complete and the groundwork laid, the center will fade into the background and the Kyrgyz Ministry of Health will take over the entire program. But the center's role will still be felt as the Ministry of Health now has solid contact with the supplier.
They will be able to get the pills for less money than they could in the country, and that's one of the problems. These pills can cost up to $2 in the country per pill, and in the States we can get it for about 2 cents a pill.
And while 2 cents per pill may seem cheap to some people, when you spread that over 3 million doses, the money does add up. However, it's a small price for the U.S. to pay for the effects down the road.
You know, oftentimes we talk about prices and the cost of doing business and doing these programs, but I think from our perspective, to be able to make a positive change on the children in Kyrgyzstan and the population of Kyrgyzstan is really priceless. And those children, the children that have been positively influenced by this program, obviously will be the next leadership for Kyrgyzstan and throughout Central Asia. So our ability to improve their health I think is a great result.
Even though the center's primary involvement in the campaign is coming to an end, they'll continue to provide expertise and guidance, helping to keep the partnership between the Ministry of Health and the Transit Center strong while enabling Kyrgyz youth to reach their potential. Tech Sergeant Joshua Gray, Transitcentermanas, Kyrgyzstan.